The following segment is sponsored by Optum Utah. Your health is your wealth. Dr. Gordon Harkness is here from Optum Utah to share why wellness visits, vaccinations, and screen tests are so important. Welcome back.
Thank you.
Absolutely. Okay, so why is it so important to go to the doctor for wellness visits?
Yeah, usually we think of going to the doctor when we're sick, and often we don't think of going to just check in on our health, to screen for things that might be coming up, or to just be prepared and be able to prevent diseases that are preventable.
Absolutely. And what can patients expect typically during a routine wellness check?
Yeah, so it's going to be different at different ages, but in general, they're going to review any medical conditions that you might already have to make sure you're on top of those things. They're going to propose some screening tests that might screen for things that you need to be looking out for, like diabetes or hypertension or those types of things. They're going to talk to you about vaccines that might be important for you as well to try to prevent disease. So it's kind of a visit to discuss questions that you have and make sure we're on top of the things that need to be taken care of so that we stay as healthy as possible.
Absolutely. And talk to me a little bit why it's so important to get vaccinated.
Yeah, so vaccines are interesting. It's one of the great inventions of the modern world, really, if you think about it. So we have a way of teaching our bodies how to fight disease before they've even seen the disease. So it's kind of like prepping for the test ahead of time. And so then when your body is actually exposed to the disease, it already knows how to fight it effectively. And so what happens then is either you never feel sick, or if you do get sick, you tend to not be as sick as you might have been. So it's a really good preventative measure. And we've got vaccines for a lot of different things. You really need to talk to your doctor, your provider, about which ones would be right for you. But in general, most people should probably think about getting a flu shot every year.
Okay.
And staying up on other vaccines, for tetanus or for COVID or for other things. But really, you should talk to your doctor and figure out which ones are right for you and which ones you're due for. Some of them are a one-time, you get it and you're done, and others you need to repeat on a regular basis.
Exactly. Well, I didn't know you're supposed to get a tetanus shot every 10 years, and I learned the hard way when I cut my finger open.
Yes.
Okay, and I want to know, how can discussing our family health history with our doctors help keep us healthy?
Oh, that's a good question. Some diseases do tend to run in families, and so it's good if there's certain diseases that run in your family, it's good to talk to your doctor about that. So some examples would be things like high blood pressure, hypertension, or diabetes, or maybe even sometimes certain types of cancer. And so, if you know these things run in your family, you want to talk to your doctor about that so that you can do anything that might be available for prevention, or if you do develop it, you catch it at an early enough stage where there's more things that can be done to prevent the downside effects of those diseases.
Okay, it's like coming up with a game plan.
Yes, yes.
And I want to know, what types of screening tests should we get?
Yeah, again, that depends on the person. So that's again the purpose why you want to have that wellness visit, to talk to your doctor about the things that you need. But depending on the situation, you might need a screening for your sugar levels for diabetes, checking your blood pressure to make sure that it's in a good range. There's screening tests for different types of cancers. So for women, cervical cancer and breast cancer. For men and women, colon cancer are common ones. And then again, with that family history, if there's certain other things that aren't tested for everybody, you may need those because of your family history, and you want to make sure we get those done as well.
Absolutely. All right, well, you can check out more. Thank you, doctor, for being on the show with us.
Thank you.
Yes.